Hey guys, okay, so I'm making a video because I'm over 5 weeks post-op right now. What are you doing? You want to be in my video?
No.
I'm gonna put you in my video.
No.
I'll look at you, hey! Okay, anyway, I'm 5 weeks post-op. I saw my surgeon on Wednesday, and he checked everything out, and he said everything looked good, yada yada. One thing though, where I had the infection up here in my cheek, along the incision line, I have like all this flesh hanging now. It's really gross, and I don't know if he saw that on Wednesday or not, because I didn't notice until like 2 days ago. Because I finished my antibiotics and I finished irrigating and everything, because everything had like healed. But I don't know what happened, but I have all this flesh hanging out of the incision now. I don't know if you can see it. You see how it's like... You can't really see it. This part here that's red, it's actually just a flap. I can like lift it and it's just skin. So, I don't know what he's going to do about that. I'm seeing him at the end of the month before I go away, and I'm really hoping he doesn't decide to like go cut it off or something, because I don't know. I don't really want to go through anymore right now. So hopefully it's not a big deal, and if it doesn't, I don't know, retreat on its own, hopefully I can put it off for a little while and maybe have it done at the same time as the gum grafting that I'm going to require, because that way I'll just be knocked out and I can have everything done at once and not have to worry about it. But we'll see what happens. It hasn't really bothered me because it's up like along the gum line, but it's pretty gross. Other than that, he gave me the okay to start chewing. The thing is, I'm chewing soft foods, but I can't really chew. So I'm not really actually chewing. Like, I'm still just having mushy stuff, or I'm letting stuff sit into my mouth until it starts to fall apart so I can just swallow it. I try to chew, but the problem is my jaw has such a small range of motion that I can't actually chew stuff. It just ends up getting stuck in the side of my teeth. If you can see, I can only open this much. I know it's pretty much about the same as right after surgery. I don't know why my jaw isn't stretching open. I know a lot of people that aren't even at the 5-week mark can open their jaw way more than me, well, except for people that are wired. But I don't know why, I can't open my jaw, and I try to like exercise it and stretch it, but it doesn't want to open. And as soon as I get it to stretch a little bit, as soon as I'm done, like 10 minutes later, I can't open it again. So I've been having a really difficult time eating because of that, because I have, like, even if I have to chew, it's like this. Like, I can't even fit food between my molars back there because the range of motion is so small. I can move from side to side a little bit, but still, it's like such an insignificant amount compared to the range of motion of a normal jaw. But he said it's not really a big deal, not to worry too much about exercises yet, and to worry more about getting movement back in my face, because my face is still really stiff. And as you can see when I'm talking, my face doesn't really move naturally yet with my words. My lips are still kind of going wherever they want to go, and I have a lot of stiffness down here. The thing is, because I had double jaw surgery and genioplasty, I've had my bones cut in so many places that I have a lot of swelling, and I probably still have a lot of tissue repairing in a lot of those places. I have plates and screws up here, over here, over here, over here, and over here. So those regions have a lot of residual swelling. As you can see, I have a lot of swelling still in here because of where they cut the jaw. I have a lot of swelling over here because of where they cut the bottom jaw. And I have a lot of swelling around my chin. My chin's not very defined yet because they cut it off and took bone off and moved it. So that's going to take a long time to go down. The other places have gone down a lot. Like along here, it's gone down a lot. Around my nose is going back to normal. Under here, I still have a lot of swelling because of all the cuts they did to the bone down here. And he said that's normal, that those places will take the longest for the swelling to go down. So even though I'm 5 weeks post-op, I still do have a lot of swelling. It takes a long time for the face to go back to normal after this surgery because it's so invasive. He said it'll take a year altogether for everything to heal. So it's a pretty long recovery. And they're cutting a bone, they're removing a lot of bone and moving stuff around, and like after surgery my face was like completely numb and I had no motion in my face at all. So it's a slow recovery, but every day I'll notice like little things getting a little bit better. Some days I wake up and my face is just really stiff and swollen. Like the last couple of days I noticed I wake up and it's really swollen and it's kind of like sore. I have a lot of sensitivity down here in my mouth, like my teeth. If I touch or if I like even poke my face by accident, I just feel excruciating pain throughout my whole teeth. But I don't have any feeling down here, so it's really weird. I just feel it in my teeth. I'm completely numb. I'll just tell you guys. Okay, I have feeling along here, a little bit of numbness around here. My upper lip is pretty much, I have feeling there, but this region down here is all completely numb, and my lip. My bottom lip, I have no feeling at all. I have no feeling at all in this whole region. And I noticed it's pretty much been the same, like the last few weeks it hasn't changed at all. I don't really have any tingling or anything, so I don't know what's going on with that. There's always a risk with this surgery that you won't regain feeling in your bottom jaw. But it's a risk you have to take in order to, correct the malocclusion and everything else. So we'll see what happens if I regain feeling down there or not. Right now, the only thing I don't like about it is that I can't feel if I have anything dripping down my face. Like when I'm eating or drinking, I still don't have a lot of control of my lips. So a lot of stuff drips out of my mouth, or like I'll end up having stuff on my face and I can't feel anything because I don't feel like temperature or anything on my face down here. So it's kind of weird. Other than that, I'm going away in 3 weeks, so hopefully by then I'll be a lot better. I still feel like my face isn't very even, but I'll show you my profile. I think it's improved like a lot. I'm really happy with my profile as the swelling goes down, because as you can see I have a lot less swelling down here than I had even a week ago. So it's still improving a lot, and I'm sure I'll have a really nice jawline once the swelling is gone and everything's flat. And once I have more definition around my chin and all the swelling around my chin goes away. But that's going to take a long time. So it'll probably, be a couple months until I can actually see what it'll look like without swelling. But I'm really happy with it. And at first I was freaking out and I hated my face. Like the first few weeks were really hard because I kept trying to accept it, and then I would get really emotional and really sad. And still now, like, it's kind of bittersweet when I see old pictures of myself, because sometimes I really miss the way I looked. But the thing is, in a lot of my pictures, I was compensating for all my bite issues, so you couldn't really see how bad my jaw and my face had gotten. Because I look at pictures, like candid profile pictures, and I'm just like, wow, like, I didn't realize how bad my malocclusion was and how much it affected the structure of my face. I was so concave up here, and I had like this, what is it called? I had a convex profile. So what that means is now my profile is pretty straight, but my profile was convex. So my nose was dragged downwards, my chin was angled downward. So my whole face was like angled like a circle instead of being straight, because your forehead should be like aligned with your chin and your nose shouldn't be like droopy. My nose was being pulled down because my upper jaw was retrognathic, which means it was too far back. So it was putting all this strain on my nose and dragging it back and making it look really bony and ugly. But that's improved dramatically from the surgery. I really like my nose like this. My nose has gotten a lot wider too because it was really narrow when it was being, I guess, pulled down. So having the fullness around here, it's just been extremely beneficial. And that's why for like everyone who's just a couple weeks post-op, you know, a month post-op, like your face is gonna keep changing. Like people tell you, oh, your swelling's all gone, oh, you look so good, your swelling's gone, and it kind of makes you feel really self-conscious because you know your swelling isn't gone and you know your face still looks kind of funny. But they don't understand with the surgery like how long it actually takes to heal. And it's not overnight, it's not a month. It's a long recovery. So it'll keep changing because I notice every day it changes, and some days I wake up and I'm like, wow, like I thought I was stuck with the way my face looked yesterday, but today it looks better. So it does improve, and I can't wait to be like, 2, 3, 4 months post-op and see what it looks like then. Because I don't have a lot of motion down here in my face, like it doesn't feel natural yet. My smile has improved a lot because my smile was all over the place a couple weeks ago. I couldn't even smile, and now it's a lot better. So that's a huge improvement. I'm taking the painkillers once in a while. I take them like when I need them. My jaw gets really tired though, like when I am trying to eat, just from opening and closing, it gets really tired. I have been trying to do jaw exercises, like, really the only jaw exercise I have to do, it's 15 minutes a day, and I just take my elastics off. My elastics are in the back. These elastics are a pain in the ass to put on, I can tell you that much, because they're on my molars, and my mouth is still really swollen inside, so I have to, like, get in there, and it's just bad. But anyway, my exercise, I take my elastics off, and I just open and close. I do that for 15 minutes. And when I open and really stretch it, I hear a lot of cracking in this. I think this side is more tense than this side, but this side I had a malocclusion on my bottom jaw. So I had a class 3 malocclusion, which is an underbite. So they probably removed more bone there when they were doing the bottom jaw, so I think that's why. But it just cracks, like, I don't know, I hear all these weird noises and stuff when I'm doing the exercises, but I guess that's normal. I haven't been having these jaw spasms that people have talked about, fortunately. I don't know if I'll have them down the road, maybe when I have more motion to my jaw. But I'm grateful for that because I had horrible jaw pain in my TMJ prior to surgery. So I haven't had, like, it hasn't been that bad since surgery, which is really good. But it's still really exhausting. My hearing is messed up, though, I can tell you that much. My hearing has been coming and going. I thought it was getting better, but last night we went to a concert, and then after I got out and I realized that I couldn't hear out of this side. Whenever I'd talk, it would sound like a loud buzzing in my head. So I don't know what's going on with my hearing, but it's probably from internal inflammation. It's just not letting my pressure in the middle ear regulate. So it's been really uncomfortable. I'm really hoping I'll try to figure out what this stuff is up here. I talked to him about the gum grafting too, and he said that it's not really urgent, that we'll probably wait and we'll do it down the road. But if he's going to have to do any type of surgery up here, I'd like to do both at once because I'd rather be asleep than be awake when he's doing anything in my mouth. So we'll see what happens. But I just wanted to give you guys that update. I'll update in a week. It was actually Friday that I was 5 weeks, but I didn't have time to update. So I'll update when I'm 6 weeks, and I'll see where I am then. Hopefully I can eat by then, but we'll see how it goes. Okay, I'll talk to you guys soon. Bye!